So as Stefan mentioned, I'm going to try and summarize what effectively has been 5 years in about 5 minutes, because I'm very conscious that I'm standing in the way of the pub at this moment. So I want to start by thinking about this as a range of different questions. And the first one, I think we really need to focus on is what we've achieved. Sometimes we don't take a step back. We look so much at the results, but we don't actually think about, well, what have we achieved as a group? So this is what we initially planned to do, so thinking back to what Stefan originally said, that we originally planned to do 9 quite small scale open non-controlled studies. And I'm really pleased to say that this has been mission well and truly accomplished. So what have we actually achieved in that time? In that time, we have done 5 randomized controlled trials. We've done 2 open controlled trials and no less than 8 open non-controlled trials. And originally we planned to involve 270 patients with mental health problems. We took that target and we smashed it. We ended up with 931 people with severe and common mental health problems included across 4 different continents. And this doesn't even include the staff members who took part, the carers and the family members who also took part. And I think that's a real testament to the strength of the research team, not only their commitment, but the links that they have with clinical services on the ground in each country. We've published 12 papers. I can say that again, 12 papers from the group. And in each of those 12 papers, it's been an author from the low and middle income country that has led and has really driven the work. And where possible, we've really tried to promote junior researchers in getting involved in publications and authoring publications. And we have another 5 that are currently under submission and 9 in preparation. And we've also had a successful PhD candidate who completed her viva only last month. And we've also applied for and been awarded 8 new grants that have come from a range of different funders. And this is to further the work and to further the collaboration, particularly focusing on community-based methods and arts-based methods. And I hope that in the years to come, we'll be up here with very familiar faces presenting on the progress of these studies. So the second question, and perhaps key, is, well, what have we actually learned from all of this? And I think really taking that idea of lower resource setting and resource-oriented interventions, there are a few common themes that we can hopefully conclude. And the first is that they're feasible. We've seen great enthusiasm, but also that enthusiasm has been matched by action on the ground. We've been able to complete all of these studies bar one. And that's at a time when we were challenged by the COVID pandemic, as well as other challenges such as funding cuts. We know that the government cut many of the grants in this area. However, that's not to say that implementation has always been easy. And moving forward, I think we now need to turn our attention to how we can work with local communities, local services, to ensure that the results here are implemented and taken further. We can say that resource-oriented interventions are acceptable, and that's from the perspective of patients, of their carers, and also of the clinicians, but also of policymakers, of people up in government. We're starting to get some real movement and momentum behind the idea of resource-oriented interventions. They're also highly, highly effective. Something that was touched upon earlier, that when we talk about effects, I used to work for NICE. I used to do some of the reviews for guidelines such as the schizophrenia guideline and the depression guideline. And we used to get excited when we got an effect size of 0.25. In fact, most of our guidelines are based on effect sizes of 0.25. Yet here we're talking about effect sizes greater than 1, and in some cases greater than 2. And when you look at these results, our first thought when the statistics came through, and this is no offense to our partners, was seriously, something gone wrong here. We almost didn't believe the effects, but then time and time again after each result, we were getting similar effects. And that wasn't just on one outcome, it was across different outcomes. And we can speculate on those reasons why, but we know from the work of Hannah and the team in Bosnia about some of those common effects, such as empowerment of patients, people finally feeling like they've got a voice and being given a voice in their own treatment, but also, particularly as we heard in Uganda, within their own community as well. And we also know about the relationships that have been formed, again, within services, but also within families and within communities. And all of these, on top of the non-specific factors, have led to some very large effect sizes, and something that we'd like to obviously explore further. But however, it must be noted that there is some variation between the different approaches. And this is particularly in the case of taking this forward in implementation. We know that Dialogue Plus has great potential to be effective, but we also know that it does rely on some technological input. We need to be spending money in services to ensure that it's set up. And we have a new advancement in terms of a progressive web application that will hopefully overcome some of these limitations. We know that family support groups, out of all of the interventions, were perhaps the easiest to implement and set up, whereas other interventions needed some kind of resource to set them up. Families, we just needed a room to meet. And then the families and people with psychosis were very much the drivers of the intervention. And finally, we know that volunteering was really effective, particularly around things such as income generation, which is something that we perhaps don't see so much in high income countries, whether it's through bureaucracy or through other reasons. But where volunteering really had an impact was where it could produce meaningful activities. However, this must be balanced with the idea that volunteering, on the sound of it, sounds like it's going to be cheap, almost free, but actually out of all the interventions, volunteering was perhaps the hardest to coordinate and needed the most input. So now this is something that we'd like to take further to understand how we can turn what on the face of it is a really effective and engaging intervention into something that's feasible and can be upscaled across different areas. Another question we can ask is, well, did we actually meet the expectations? When we started this project, we asked all of the researchers and all of the team what they hoped to get out of this and what they thought they would get out of it. And then we followed up the same people and other members of the team to actually find out about those experiences. And on the whole, we found that generally we met or exceeded those expectations. And that was around the commitment to the research, the being able to get involved in different research opportunities, having a transparent communication. It's one of the things that I've really enjoyed working with this group, is just how the group has clicked and got on, and how we are able to come together from very different backgrounds, from very different places, and work together as a team and as a group, not just as individual countries. But that's not to say that we did well in all areas. There's still room for improvement. And a lot of this, I think, relates to some of the nature of the funding. It's very hard to promote that idea of equal power dynamics when the funding is being given to one institution with a set of conditions and rules, such as forms that need filling in, certain conditions, certain ways of working. And I think until we can look at perhaps a more global way of funding, or ensuring that the partner countries are the leads in receiving the funds, I think there's always going to be this potential for a power imbalance. And it's the same with innovation and mutual learning. And in terms of strengthening research capacity, we made great gains in strengthening the research capacity within our institutions, and particularly of our junior researchers. It's one of the things we are most proud of, our junior researchers. However, this must be taken in a wider context. It's very hard to capitalize on those gains in a system which doesn't support it. So unless we have that infrastructure, unless we can strengthen the infrastructure in the particular institutes that we're working with, we can create fantastic individuals, but we need to be able to put them in an infrastructure which can support their further career development. But on the whole, we would say that this has been a truly fantastic experience, and one that we're pleased to say has met our expectations. And I think it's fair to say that we're wanting to go places next. So we have a range of new projects that have come out of the collaboration, and we hope that this is just the start point. Just mentioned a few of the ongoing studies we have here going on at the moment. You'll notice a lot of them are looking at this idea of art and community-based resources, and it's something that we're very keen to explore. And really, just to conclude, I think it's fair to say that for all of us, it's been a journey. And this is just a chance to get the photo album out, if I'm honest. So it's meant that we've had some fantastic workshops with different members, and we've done this in different countries and in different settings. And this has ranged from workshops with the community to clinicians to workshops with researchers where we've sat there with pens and paper and we've scribbled out the designs of studies. We've also made new friends along the way, particularly with our arts organisations. This is a photo from Argentina when one of the new studies, Orla, which was came out of the collaboration, particularly in Latin America, met with a lot of the artists who have been, we heard about, for example, from Pancho's study about the theatre. And this is an ongoing relationship, and these are new friends that we want to take on this next journey. Perhaps most relevant to where we're going next is we've really been able to sample the local delicacies in each of the countries. And we make it a real point that wherever we go, we try to at least trial some of the culture. So these were just, this was myself and Kat. I asked Kat for some photos of what would represent her journey. And between us, this is what we came back with. So without further ado, I'd like you just to raise a glass, most people have cups, to all of the partners of this project, because it really has been a truly wonderful global experience. And before I hand back to Stefan, I would like to send my heartwarm thanks to all of our collaborators. Thank you.